I'd like to welcome you to the 29th edition of this Insight webinar. Insight webinar is a series hosted by eHealth Africa, and this series brings together public health professionals to discuss critical issues and explore ways to enhance healthcare delivery. So if you're just joining us, welcome. You can share the link to your friends and colleagues and people who you know should be in on this discussion. My name is TJ Sodrumu, and I'll be your moderator for today's discussion. So let's get started. Quickly, I'm just going to give a background to the subject of today's discussion. We're talking about innovative strategies to reduce vaccine wastage. So vaccine waste is a growing challenge in healthcare systems worldwide, leading to increased costs, resource shortages, and environmental concerns. Inefficient inventory management, improper storage, and expired or unused supplies contribute significantly to this issue. Vaccination, for instance, is widely recognized as one of the most cost-effective and life-saving public health interventions. However, a major challenge to achieving optimal immunization coverage is the significant wastage of vaccines. So, adopting innovative strategies such as technology-driven tracking systems, improved supply chain logistics, and sustainable practices can really help us reduce waste, optimize resources, and enhance patient care. So, building on the January edition of Insights webinar, for those who were with us last month, we focused on bridging vaccination gaps. So this month's session, we're taking the conversation further by exploring innovative strategies to minimize vaccine wastage across the supply chain, ensuring more efficient and effective immunization efforts. So once again, I welcome you to the 29th edition of Insight webinar. I tell you, it's going to be exciting, it's going to be interesting. And so I look forward to getting questions from you, and then our panelists will be taking those questions. But before we go further, I'd like to, I have the honor and privilege of welcoming a distinguished guest to our webinar. He's a valued member of the board of eHealth Africa. He goes by the name Andrew Karlyn. Andrew is deeply passionate about supply chain management and the effective preservation of vaccines. Please join me in giving him a warm welcome as he delivers his opening remarks. Andrew, you're welcome. The floor is yours.
Thank you so much, Jesu, and hello, everybody. Good morning, good afternoon, good evening. It is a great pleasure to introduce this panel and frame this really important question. eHealth Africa and eHealth Group has been working in the field and sector of vaccine management, delivery for polio, immunization, routine immunization, as well as immunization campaigns for over 15 years. And our commitment is really always to stay on the vanguard or on the forefront of immunization policy, on efficiency and effectiveness in delivery through public sector, also through private sector, and the combination of the two. And as we heard in the introductory remarks or in the framing of the webinar, this issue, as much as we've made great progress in the sector, continues to be a major source of concern. We see an overall wastage of vaccines for various reasons, which we'll go into today. Of 50% of more vaccines will may be wasted for these various reasons. It could be because of open vials, because we don't have efficient utilization once a vaccine has been opened or is delivered to the last mile. That can range between 20 and 70% just on its own, as well as the COVID-19 pandemic and vaccine response really highlighted some of the amazing feats that were undertaken particularly in handling vaccines that required ultra cold storage and transportation, but also the fact that the infrastructure around that for both child and adult vaccines wasn't fully up to that task. And those investments have really seen important lessons and lessons learned from that. We know within the first 6 months of vaccine delivery for COVID. Up to 500,000 doses were just lost because of expiry, because of the challenges of management. And even more so, data shows that over the first year in Nigeria, indications that over 1 million doses of vaccines were lost. This is a natural occurrence in some ways because it's very hard to manage a very complex supply chain and supply chain systems. And we know that anything that we can do, and particularly the application of technology, can make a huge difference in that success. For that reason, recently, eHealth Africa and eHealth Group have acquired the parcel temperature monitoring global health suite. That solution complements our existing vaccine delivery efforts and allows us to put sensors into along the cold chain and transport and delivery, as well as that last mile delivery, to be able to log and use for decision making for cold chain vaccine management personnel, for government as a whole to monitor, as well as for facilities and physicians to have confidence that the vaccine that they're putting in that child's arm or in their mouth has been handled properly, is within expiry, stayed within the temperature range. So we're building confidence in the system. I think that's an important part of vaccine, and vaccine hesitancy is really about trust. And so the more that we can show visibility, trust, and reliability, that's called value for money and impact, and that's ultimately what we're after. So I'm very pleased to be part of this webinar. I'm very curious and interested to hear the different perspectives from all the various speakers. And thank you very much. And I'm sure we'll have some insights to share at the end. Very good. Over to you.
All right. Thank you very much, Andrew, for that warm opening remark, talking about EHA's strides in innovation around vaccine wastage prevention. Thank you very much, Andrew. All right. So we just move on to introduce the panelists for today's conversation. Today's panelists are leaders in supply chain management. They have worked for many years to ensure a better preservation of vaccines. And I'm going to introduce them in no particular order. When I introduce them, they will unmute their microphones and say hello to you, the audience at home. All right, so the first person I'll be introducing is none other than the Deputy Director of Supply Chain Management at eHealth Africa. He is Mr. Kazim Balogun. He provides strategic and operational leadership to expand eHealth Africa's supply chain management and public health emergency management programs. His responsibility includes driving innovation, ensuring program quality, and maximizing impact in cold chain management and supply chain optimization. One of his notable achievements includes leading the establishment of emergency operation centers in 24 African countries to improve planning and coordination of immunization campaigns and facilitate timely response to disease outbreaks. He contributed to the development of a robust data management system and evidence-informed programming. Mr. Kazim Balogun, you're welcome to this webinar today.
Thank you so much, Tijesu. Hi, everyone. I'm excited to be here.
All right, thank you. We're excited to have you here also, too. All right, so next on my list is Mr. Jamil Galadenchi. Mr. Jamil is the Senior Manager of Software Engineering at eHealth Africa. Jamil brings a wealth of experience with over a decade of expertise in health informatics and tech innovation. He is a registered counsel for the regulation of engineering in Nigeria, software engineer, Prince 2 certified project manager, and a certified quality assurance engineer. He has been at the forefront of designing digital solutions that directly tackle some of the world's most pressing health challenges. Jamil's unique blend of technical knowledge and leadership in software engineering makes him a key figure in eHealth Africa's efforts to drive impactful health outcomes through technology. Jamil is also the technical lead for EHA Academy, which a lot of you must have seen online. It's a free web and software development training platform powered by eHealth Africa. Hello, Mr. Jamil. We're happy to have you here.
Thanks, Jesu. Happy to be here, and hello, everybody.
All right, thank you so much. And last but not the least, we have here the State Coaching Officer for Sokoto State. He's Pharmacist Nafiu Abdullahi. Like I said, he's currently the state cold chain officer in Sokoto State, where he plays a crucial role in overseeing and managing the cold chain logistics and infrastructure for the storage and transportation of temperature-sensitive products in Sokoto State. He is a gentle, multi-skilled young pharmacist with years of experience in public health, commodity management, and commodity security, having attended series of training as a vaccine logistician. Pharmacist Nafiu is a master trainer of vaccines management training, Open LMIS, as well as NHLMIS. He has worked in, and pardon, all those acronyms. It has to do with vaccine management. He has worked with important stakeholders like the World Health Organization, Site Savers, Affinet, CHAI, Solena, eHealth Africa, amongst others. He has a master's degree in public health from ABU Zaria. Pharmacist Nafiu, we're happy to have you on this webinar.
Good afternoon to Jesu. Thank you. I'm glad to be with you. And good afternoon to everyone. Thank you.
Thank you very much. All right. So before we listen to the expert talk to us about vaccine management, we went on the street to find out what the average Nigerian knows about vaccine preservation and wastage. And so, IT, please help us put up the video. Let's see what people had to say. What do people really know about vaccine wastage and vaccine preservation?
Let's hear from the voices on the street.
Well, basically, one of the major causes of vaccine wastage is lack of enlightenment as regards what the vaccine is all about.
I don't have the idea.
To da Hausa a ce ya lallace idan an aje magani ya wuce adadin lokacin da aka ɗeba mishi.
The major causes of the vaccine we're talking about, people are just being scared. Like I said, the enlightenment is very, very important. Let's get to make people aware.
Proper storage of vaccine in the hospital or nearby healthcare.
Yeah, you meet one or two people, enlighten them, let them know. Maybe even on the social media, place it there, on the radio station.
Da zamu shine duk abin da aka kirkire shi an san kuma yana da date da zai lalace shine. Ya kamata a using da shi kafin lokacin da zai zo kuma ya lalace din. Kafin lokacin kaiwa lalacewa shi ya kamata a yi amfani da shi inda dama.
All right, thank you very much, IT. I'm sure that a lot of us must have formed, varying opinions concerning what we have heard. But I'm going to, give my opinion to myself and share it in the next few minutes. Okay, so we conducted a poll on social media also to find out what people think the cause of vaccine wastage is. So can we also have the poll up so we can see it? Can we have the poll up, please? So just watching the interview on the street, one thing you can all agree on is the fact that Nigerians are very bold, and even in situations where they don't have the full information, they still have something to say about the subject matter. Okay, so we put this out. What do you believe is the primary cause of vaccine wastage? And 53% of people selected supply chain and distribution issues, while 35% selected improper storage and temperature control. All right, so I think we can now jump into the conversation of the day. We've heard people on the street, we've seen their level of knowledge. We've also seen people on social media, and we've seen some of the choices they've made. Now we want to listen to people who have built expertise in this field. And so the first person I will be shooting my question to is Pharmacist Nafiu. So what are the general challenges you face when it comes to preserving vaccines? And you are the best person to answer this question because you are a state cold chain officer. So what are the practical challenges you face when it comes to preserving vaccines?
Okay. Good afternoon again, to Jesu. I can see this is my third year of being the state cold chain officer for Sokoto State. And if I'm not mistaken, vaccine is one of the most difficult pharmaceutical products to deal with. in terms of handling, in terms of storage, in terms of distribution, and also usage. We all know that vaccines are from the organisms that normally cause the infection, but it has been subjected to a temperature that does not cause infection if injected into the human body. But looking at that, we need to store vaccine in an appropriate temperature, because there are some vaccines that need a temperature of even -15 to -25 degrees to be maintained, to maintain its potency. And there are vaccines that can be maintained at the temperature of +2 to +8 to maintain its potency. Such vaccine like measles vaccine, yellow fever, MenA, we all know they are lyophilized vaccine. And if it is not stored at the right temperature of -15 to -25, there is likelihood of that we are going to waste more of the vaccine. And it is very difficult to maintain the temperature, because number one, you have to have a steady light. You have to have a steady light electricity that can power the culturing equipment, because the culturing equipment, they are designed in such a way that they regulate the temperature. And we have TMDs, what we call temperature monitoring devices. And that temperature monitoring devices, they are also designed in such a way that they can alarm the condition of the temperature inside the culturing equipment. And for that, you need to have a steady power supply of 24/7 to make sure that the vaccine are being kept in a right temperature. Secondly, we also have issue of distribution and management. For you to have a potent vaccine right from the manufacturer, that vaccine must be maintained at a certain temperature. And also, even when taking it from the manufacturer to the warehouse, let's say national warehouse, strategic warehouse in Nigeria, they're moving it from national strategic warehouse to state. That temperature must be maintained. And even moving from the state to the LGA level, to the facility level, and also to the service delivery point, that temperature must be maintained. Any deviation from that temperature then will lead to the alteration of the vaccine potency. So it is very difficult to maintain vaccine, and at the same time, it's very costly to maintain the efficacy and the potency of the vaccine. And also looking at the personnel that will handle the vaccine, they must be trained personnel, because anyone that handles the vaccine, he must be a skillful person that know how to handle it and know the appropriate temperature to keep the vaccine.
Thank you very much, Pharmacist Nafiu, for that. I mean, from what you have shared, I mean, you've mentioned three important things or challenges that you face in your day-to-day. One is the issue of temperature, maintaining the appropriate temperature for these vaccines via stable electricity or power supply. And the other thing you mentioned is distribution management, maintaining the potency from the manufacturer to the warehouse, at the point of use. And then the third thing is training of personnel to handle the vaccine. Thank you very much. If you're just joining us, I want to welcome you again to Insights Webinar, the 29th edition, and we're talking about how to innovatively reduce vaccine wastage. All right, so the next question will go to Mr. Karlyn Balogun. And just before that, please, if you have any question, put them in the Q&A box. And when we get to the end of this conversation, we will take your questions. All right, so this next question is for Mr. Karlyn Balogun. eHealth Africa, recently acquired the Parcel solution to improve supply chain management. So we heard Pharmacist Nafiu talk about, one of the major challenges, which is distribution management. So now eHealth Africa recently acquired the Parcel solution to improve supply chain management. Can you please explain to us, how does this really work?
Yeah, thanks again to Jesu. Hi, everyone. Once again, I'm excited to be here. I think Pharmacist Nafiu told us about one of the major challenges, and which essentially is one of the reasons why eHealth acquired the Parcel Global Health, monitoring business unit. Parcel is a company that deals in insurance, risk and insurance management, as well as global health monitoring solutions. But eHealth Africa recently acquired the global health monitoring business unit of Parcel as a company. And why did eHealth Africa acquire that unit of their business. It's largely in fulfillment of our mission to drive forward, our mission, as already mentioned earlier by Andrew, and our mission largely to build stronger health system, through the design and implementation of data-driven solutions that respond to local needs. Some of the local needs, as already mentioned by the state co-chain officer for Sokoto, Pharmacist Nafiu. And so eHealth Africa acquired that in order for us to be able to further our mission as an organization. And how does these solution, how do they work? In layman language, the solution help decision makers and people involved in immunization to be able to monitor the temperature of temperature-sensitive health supplies and commodities. And our solution is designed, to ensure that temperature-sensitive healthcare supplies, such as vaccines, medicines, and even blood and blood products, are stored and transported at the optimal condition that they're expected to be transported. And so it helps whether you're using it during shipment or you're using it for storage. It helps you while keeping vaccines, essential health commodities like vaccines, medicines, and blood products to ensure that they are kept at the appropriate temperature. And how does it do that? It will alert you, depending on the threshold, that using our cloud-based platform, it will set the threshold as maybe desired by the users and the decision makers to a particular threshold that would enable them to receive notifications, near real-time notifications around when the temperature, drops. For example, when there's what is referred to as temperature excursion, or there's a deviation from the expected temperature that those, the vaccines and other essential commodities are expected to be kept, you will receive a clear alert, an alert that helps you to be able to take, quick decision. And while the solution is kept, in a cold room or in a refrigerator, it continuously collect data, and that data is what you need to be able to take, insightful decisions around. Oh, we kept vaccines in so cold room, but the temperature has dropped largely because there's a power failure. So that helps us a lot in maintaining the potency of the vaccines and ensuring that there is no wastage of the vaccines that we are even looking for to be able to reach all of the children that are expected to be vaccinated. Our solution is also very cost effective because of the fact that it helps you with very small amount of money to be able to make sure that we avoid wastage. While making sure as well that you are able to make prompt decisions, to avoid vaccine wastage. And so, in summary, our temperature monitoring solutions, is geared towards enhancing supply chain management as well as reducing waste. In summary, thank you.
All right, thank you very, very much for that clear explanation. Just in case you need more clarity or you have questions, please do not forget to send your questions into the Q&A box. Thank you once again, Mr. Kazim Balogo, for explaining what this means. For everyone that understands how vaccines work, that they are temperature sensitive, and generally for anything that is temperature sensitive, that it's important to really ensure that those items are kept within the expected temperature to maintain potency. And so for the African continent that is still struggling with the availability of power, we're talking about rural areas that don't even have light for a long period of time. There are even places where they don't even have power supply at all. Having these vaccines go to these places and maintain potency, there's a need for tracking of temperature, to be able to tell when the vaccines or the temperature sensitive goods are at risk of, either expiring or losing potency or getting spoiled. And, without this temperatures sensitive or temperature monitoring solution, we will really not be able to, track what is going on with this temperature sensitive items. So I think that this is a great thing that EHA is bringing to this space. Okay, so my next question is to Mr. Jamil Galadechi. What are the current existing solutions used by eHealth Africa for supply chain management?
Thank you to Jesu. And so for the solutions we have at eHealth Africa, I think the key one is our award-winning Loomis suite, which is a solution that tries to address the end-to-end supply chain management. And initially, there were two isolated solutions. There was the Loomis stock, which was focused on managing the stocks at a given facility. And like Pharmacist Nafiu mentioned, we've heard about all the challenges, we face when we are trying to store and manage vaccines and other health commodities at different facilities. So that tool was built to sort of ease the management of those commodities, even at last mile facilities. The other solution, which is the Loomis Deliver, is meant to now address the second challenge that Pharmacist Nafiu mentioned, which is vaccines and other health commodities in transit. So that in transit, you are able to track and also manage those commodities moving from whether it's a central store to other facilities at last mile. And these solutions were built mainly for the health supply chain space. And that is what makes it unique from other logistic management solutions, because we built them together with the stakeholders operating in the field. In fact, our first deployment was for vaccine project, that's the VDD project in Sokoto. And that's why when you're looking at Loomis, you could easily tell that this is a solution that was built purposely for managing vaccines and other health commodities. I don't think there's time to go into the key features, but most of the features are actually addressed by Nafiu. So there's the problem of, even tracking the expiry date, which is key. And even from our survey that we played, the video we played earlier on, a couple of the people mentioned about expiry. Now it is critical to be able to prioritize which commodity you dispense first, depending on the expiry. So these solutions allow us to be able to track the batch numbers and the expiry dates of those vaccines and other health commodities, and they send periodic alerts depending on how you set it up, from monthly to weekly, and then once it starts getting too close, it's the frequency of the alert increases. This is all in the effort to make sure that we don't waste those vaccines due to expiry date. Another key feature that we put in there is the temperature. We've attempted using different temperature monitoring devices in the past. We were able to succeed to some extent, but now with Parcel on board, we are even more confident that we'll be able to holistically address the temperature sensitivity of those commodities and how to be able to manage. In terms of the delivery side, we are able to track those commodities in transit, and we are also able to track those that have to be returned back to where they were initially dispensed in case of any failure of delivery. We're also able to optimize the delivery route, which we call route optimization, so that we guide the drivers on the best route and where to deliver first. So there are a number of other features on the solution that are tailored to just ensuring that most of the challenges highlighted by Nafiu and by those surveys that we've had out there, we are able to address through those solutions. Thank you.
Right. Thank you very much, Jamil. It's quite exciting to hear all of this innovation to respond to one challenge or the other in the vaccine supply chain space. Thank you very much for sharing that. For everyone following us on Zoom and on LinkedIn, I think we put it there. If you want to read more about this new acquisition of eHealth Africa, the parcel, the link is in the webinar chat. You'll see it there. To read more about EHA parcel, you'll find the link there. You can click on it to learn more about this newly acquired solution. But a quick one to Jamil. You've spoken about Lomis stock for managing commodities on site at primary healthcare facilities. You also spoke about Lomis Deliver for managing items in transit. Is there, and you might not answer immediately, or maybe you might put the answer in the chat box. Is there like a web page where people can go to learn more about these solutions? I know that you're unable to talk about everything, end to end. So if there's a website, you could kindly, put it in the webinar chat box for people to read and learn more about. Well, thank you very much. And I see the questions coming in. So please keep them coming. We'll take them. Okay, so the next question goes again to Pharmacist Nafiu. So you had shared earlier about the three core challenges that you experience working day to day as a state cold chain manager. So now, what are the current strategies you deploy in reducing vaccine waste in primary facilities, especially in rural communities? What are the strategies you deploy? And maybe you might mention a specific, facility or a specific local government, to just bring it home. Make it more relatable. Yeah.
Thank you, Tijesu, for giving me opportunity again. Currently, let me set the example with Sokoto State. We have developed a lot of ways to make sure that vaccine wastage has been reduced drastically, even at the LGA and the facility level. Currently, we have temperature monitoring devices that we normally use in our refrigerator. But before then, we have a procured solar refrigerator from UNICEF, and which is currently being distributed to the facilities for the storage of the vaccine. And that solar system is called SDD Solar Direct Drive refrigerator. It works with solar direct without even electricity, and it keeps the vaccine at +2 to +8 in the fridge compartment. And we also have the freezer compartment, which also bake an ice pack so that if there is any outreach that can be conducted within the rural area at the facility level. And at the same time, we have the temperature monitoring devices like a fridge tag. There is fridge tag in all the solar refrigerator, and that fridge tag is responsible for the taking the temperature inside the refrigerator and making sure that we have a complete report of the temperature from first day to even 60 days. It can give you a complete 60 days of what happened in the refrigerator if you use your laptop to make sure that you collect the data. And at the same time, we trained all our personnel at the facility level. I could remember we had a training in Sokoto State where we trained almost 351 RI service providers. We trained them on the handling of cold chain equipment, handling of vaccine, and proper usage of the vaccine, because we have seen that it's necessary for us to do that, because from the report that we are having, the vaccine wastage is always at high level, especially with regard to the vaccine that need multi-dose vial policy to be implemented, like Penta, PCV, IFV, Rota vaccine. They are all under multi-dose vial policy that you can use it for almost 28 days if the MDBV, that's multi-dose vial policy, has been followed according to the WHO guideline. Thank you.
All right. Thank you very much, Pharmacist Nafiu. Thank you. Thank you. If you're just joining us again, I'd like to welcome you. This is the 29th edition of Insights webinar put together by eHealth Africa, and it's a platform where we bring seasoned experts in public health to discuss important topics. And today we've been talking about innovative strategies to reduce vaccine wastage. If you've been listening and you have questions, please put your questions in the chat box and we will take it. All right, so my next question goes to Karlyn. You've spoken about eHealth Africa recently acquiring a solution to help improve supply chain management. So why do you think this solution, the solution is EHA Parcel? Why do you think EHA Parcel can be a game changer in vaccine supply chain management?
Yeah, again, our EHA Parcel solution is a potential game changer when it comes to medical supply chain management. And that is largely because of the fact that for most other solutions out there, ours provide that end-to-end visibility into storage and transit conditions of temperature-sensitive medical supplies, such as vaccines, medicines, and blood products, and other temperature-sensitive commodities that are used, at health facilities and during immunization campaigns. And so, in providing real-time monitoring status to stakeholders are able to take an informed decision, to avoid vaccine wastage. And, the scarce resources and funds that are used or invested in immunization can be optimized, instead of allowing vaccines to waste, or lose their potency. We would be able to, with very minimal investment, ensure that we reduce, vaccine wastage. In addition to that is the fact that, and how does that happen is because our solution will offers proactive alerts, proactive alerts in the sense that immunization managers, vaccination campaign managers and cold chain managers can quickly take informed decision as a result of the fact that they receive notification early enough. And if there's a temperature deviation at any point in time, they're able to take prompt action to avoid degradation of critical medical supplies or even spoilage, that will result in wastage. And again, the important point that also makes ours, a potential game changer is the fact that it is very cheap. It's not expensive when you compare it to the cost of vaccines when they end up wasting. And so that is why our solution in integrated, maybe in integration with some of our other solutions like Jamil mentioned, LOMIS management, logistics management information system, LOMIS, will provide you both end-to-end visibility to your commodity status, while also offering you, near real-time insights as to how your temperature-sensitive commodities are doing. That enables you to make sure that we avoid losing vaccine potency, that could arise as a result of where you don't have visibility to how your temperature-sensitive commodities are doing, as some of the uniqueness of our solution. And when combined with others, like our logistic management information system, LOMIS, also our blood information management system, BISCIT, offers you not just, provide you not just, information that will help you to take informed decision around temperature, but also gives you visibility, to how your stock, level is, and you can take appropriate decision. And that way, even in health facilities, we're able to avoid issues of stock out. We ensure that in hot weather, like we are beginning to see in several parts of Africa, and with the climate change that we are seeing and the effects of climate change, having solutions like EHA Parcel remote temperature monitoring solution would be an appropriate investment, to avoid vaccine wastage, amongst other things. Thank you.
All right, thank you very much. Thank you very much, Mr. Kazim, for sharing that with us. I mean, I put some things down. The fact that we're able to get end-to-end visibility, notification of storage and transit conditions of medical supply, I think truly that's a game changer. That's a game changer. And this, in turn, enables people at the management of these commodities to take the right decision. And the fact that it's cheap and affordable too, I think that's a game changer also too. That's a game changer. Thank you very much for sharing this with us, Mr. Kazim. All right. The next question will go to Jamil. Jamil, how can we integrate solutions like LOMIS into EHA Parcel for optimal outcome? And I'm also just looking beyond LOMIS too. Maybe there are other solutions that other organizations also use. How can these solutions be integrated into EHA parcel for optimal outcome?
Thank you, Tejesu. So we all know that the public health space in particular is an interesting space. It involves a lot of key stakeholders and a lot of systems. And that's why, and because we are building our solutions mainly for the health space, we build them in a way that they are easily interoperable. What I mean by that is that they are able to speak to other systems. We build them based on APIs, so just to be more specific, so that you are able to connect the solutions with other systems. A good example is most of the time, this vaccine-driven programs, whether the routine immunization or campaigns, involve external donors and other stakeholders, and that visibility over what is going on, irrespective of your location, is important. So we always make sure that our systems are connected to dashboards, analytics dashboards, that would be able to give that high-level data analysis and other necessary information to all the key stakeholders. And that's why our solutions are built in such a way that we can be able to integrate them with systems like Parcel. And like I mentioned, we've attempted using other temperature monitoring devices in the past. Now, what makes Parcel unique in terms of able to acquire it and have it integrated in our solution is that we are not only able to control the software aspect of the system, but we also have control of the hardware. And we know how important that aspect is, because we've seen it a number of times where systems are built to operate in a particular environment or in a particular setting with a specific infrastructure. Now, if those hardware are not customizable to fit into whatever and wherever we go, and you've mentioned in your introduction that Kazim is covering about 20 countries, and each country can be, can have its own specific features of set up, and we should be able to fit in our solution to those situations. And that's one good thing about Parcel. We don't only own the solution as a software, but we also have control over the hardware. So we're able to ensure that it works irrespective of internet or not. And that's why we built our solutions to be offline and then be able to pull the data when there's internet. But with Parcel, we are also able to use the GSM or the Wi-Fi internet, and it comes with different types of devices. So there's the small portable ones that we're able to integrate with the cold chain equipments. There's the passport, which we are able to put in a facility, and it's able to communicate directly back to the dashboard. So there are lots of properties and features that these solutions will have once they're integrated, that they will be able to give you that end-to-end, like you mentioned, solution of all the challenges that we face within the cold chain. I hope I've answered your question.
Yes, thank you very much, Jamil. Thank you so much. Okay, so I see our questions are pouring in, and we have a couple of minutes, so we'll just start throwing the questions to the panelists. And so if you have more questions, please put them in the Q&A box. So the first question will go to Pharmacist Nafiu. So this is from Philemon, and he's asking, what do we know about how long a vaccine can stay potent outside of its required temperature? So how long can a vaccine stay potent out of its required temperature? And the question has, like two parts. The second part is, how is the current supply chain equipped to handle this particular temperature issue? So he says EHA Parcel might be solving this at some supply chain level, but which supply chain level needs more innovation? Okay, so I'll just throw the first one to you. How long, can a vaccine stay potent out of its required temperature?
Okay, thank you so much. When we are talking about vaccine potency, we are talking about maintaining the temperature. And we have BBM stages. So each vaccine has a BBM level attached to the vials of the vaccine. And that BBM stages, it is in colored. You have an inner square inside a cycle, and that inner square is white. And when it starts turning to a black, you will see that it changes from stage 1 to stage 2. And then when it is completely the same, the inner square and the outer square is the same, then it is stage 3. And when the inner square is darker than the outer cycle, it is stage 4. And you can only use vaccine at stage 1 and stage 2 BBM stages. So this is with regard to the accumulation of heat that vaccine absorb outside the cold chain system. And also at the same time, we have BBM, we have stages, and we have also BBM type. What we mean by BBM type, we have vaccine that at BBM type 7, we have type 14, we have type 28. BBM type 7, it means that vaccine, we have even type 1. That vaccine in the next 24 hours, if it is exposed outside the cold chain equipment, it will jump directly from stage 1 to another stages that cannot be used. And type 7, we have vaccine that once it passed around 7 days outside the cold chain equipment, that is in a body temperature, in a body temperature or room temperature, then that vaccine can jump from stage 1 to another stages. So all this need to be taken care, because once you expose the vaccine and you pull it out of the temperature, then it is about to enter another stages and cannot be used.
Thank you very much, Pharmacist Nafiu. I think one thing I like from your response is the fact that you were able to visually tell when the vaccine vial is going from one level to another. And so by that visual indicator, you're able to tell that, okay, this is about to expire. This is on level 2. This is on level 1. And that's a great thing. Okay, so this second question, I'll put it to you, Mr. Kazim. I think it's an opportunity to either clarify or still emphasize on what EHA partially does. So this person is asking that what supply chain level needs more innovation? The broad question is that how is the current supply chain equipped to handle temperature issues? And the person feels that the EHA parcel might be solving this at some supply chain level. But the main question is what supply chain level needs more innovation?
Yeah, thanks for that question. I think across the supply chain management, we will not, depending on the priorities of the users and stakeholders, what is important is across all of the chain of the supply, there's a need for end-to-end visibility. Innovations, we need innovations at all levels, during transit, during storage, transit, which includes distribution. We need innovations that would offer us insight into how whether the utilization of commodities as well as the temperature, and that is where our EHA passive solution becomes very relevant. There are so many supply chain solutions out there that work in silos, but what ours, like already mentioned by Jamil, is ours is interoperable with any other solution that is out there. You can use any of our remote temperature monitoring solution alongside whatever supply chain solution that you have. We'll make it interoperable for you. And ours also, why it's also important for us to have end-to-end visibility across the entire chain of supply, of health commodity supply, is to make sure that we plan appropriately, whether it is routine immunization or we're doing campaigns, to reach children that have never been reached or those that needs to be reached. Having that visibility, at every point in time, with the aid of Internet of Things, technology, and solutions like ours, offer, decision makers an opportunity to not just see the stock level, but also ensure that these essential commodities maintain the right temperature that they are expected to maintain. Because it's a different thing entirely for you to have the commodities, but is it, what about their temperature? If they are unable to meet or address that challenge, then at the end of the day, all of the resources that have been invested in that entire process becomes a waste. For example, if a vaccine, whether consciously or unconsciously, loses its potency or efficacy, it means all of the investment, across the entire chain becomes a waste, even when you deliver at the last mile. But when the potency has been lost as a result of the fact that we are not able to maintain that temperature and that the expected temperature that are expected to be delivered, and vaccines, for example, administered, to children, then the entire process becomes a waste.
All right. Thank you very much for that, very elaborate response. So this question is a quick one for Pharmacist Nafiu again. Someone is asking, when you answered the first question, you've spoken about training for personnel that handle this vaccine. So this person is asking, how is training currently for those that carry out vaccine-related work? So as a state cold chain officer in Sokoto State, how are trainings being done for those that carry out vaccine-related work? This is for you, Pharmacist Nafiu. Okay, he looks like he might be having internet issues. So I'm going to come back to you, Kazim, because there's a question that I believe is also very peculiar to you and the work that you've done. So someone is asking for conflict-affected areas or hard-to-reach areas in Nigeria. How does technology help address this? We've just spoken about temperature generally, but when we now include conflict and security-prone zones, how does this technology help, address vaccine wastage in that scenario?
Yeah, sincerely, in fragile, settings and post-conflict areas or conflict areas, the one solution is the aid of technology, and technology is what will bridge whatever gap in terms of accessibility, as a result of conflict and people who are displaced. And so a combination of technological solutions, like some of the solutions like that eHealth Africa have, would become, will provide that respite in terms of ensuring that the people who are in need are able to be attended to timely, and also making sure that is done efficiently. So technology such as some of eHealth Africa's solutions using our plan field for proper planning, since you will not be able to probably assess that place because of the conflict, using our solutions like LOMIs, making use of solutions like our EHA passive devices and solutions are some of the things that becomes relevant in such conflict-affected areas.
Okay, thank you very much, Kasim. My next question is for Jamil, and I want you to take a futuristic dive. As a software engineer, what possibilities do you see in terms of artificial intelligence around reducing vaccine wastage, in remote communities and underserved areas? What possibilities do you see in the near future?
Thanks, JJ. So, and it's interesting you asked this question because we are already looking into the future. We have a number of features lined up that we want to integrate on our LOMIS, and most of them are, AI powered. We want to bring in a lot of prediction. We understand that even with the tools. So first of all, what we did by integrating these solutions together is to avoid the overload that we usually give to people like Pharmacist Nafiu and other people working within the supply chain space, where you have multiple solutions or multiple applications to deal with. So we try to bring everything under one platform. So you're able to manage the facility, manage on transit or in transit, and also manage your temperature, all within the same platform, and other indicators that are very important. We know how reliable or how reliant even clinical trials are on some of those indicators for us to be able to validate the outcome of those trials. So that's why we brought everything under one platform. Now, all of a sudden, bringing those solutions under one platform gave us a very good opportunity to now put in AI for predictions and for other analytics. So for example, instead of waiting until a health facility manager go through the alerts of products that are expiring or products that are running out of stock and then make a request for supply, what we are intending to do now is our AI system or our LOMIS, which will become very soon an AI-powered system, would be able to predict when, based on your past usage record and other data that we will aggregate, we'll be able to predict when to make the next request for supplies and when those expiry, what kind of or what length of expiry date you require for your vaccines so that we make sure that we don't supply the wrong vaccines, because like Nafiu mentioned, even from the supply, you should know that if I take a vaccine that will expire in 2 months, then we'll run out of time before we utilize that vaccine. So all those are some of the predictions that we'll put in our system so that at least people like Nafiu and other officers will focus on their job, knowing that there's a system looking end to end throughout their commodities and other. We even have some equipment management because we understand that vaccine alone is not, or solving vaccine-related issues is not enough. You also have to take care of other equipments. For example, the syringes they use, the vaccine, the supply chain box themselves, on other storage systems. All those are actually being tracked and managed by our system. So if we have all that data, we are able to manage it automatically, and all we need is from time to time, for example, if we initialize automated request for deliveries, we would want someone to at least approve it. So all you need now is for the facility manager or whoever is in charge to just look at the request and say, yes, approved, and that's it. And then the driver or whoever is responsible for the supply will receive that information, and even the warehouse supply will also receive it. So making the entire process seamless. And when you come into this health facility at any time, you don't need to worry about checking the temperature of a particular storage or checking the expiry date of a particular commodity. You all have it on one dashboard. And that's one key feature about Parcel that makes it quite unique. The depth of analytics and visual information on that system is at another level. You are able to see almost every nitty-gritty data that you need to be able to make decisions and also improve the confidence of not only the consumers of the vaccine, but also the rest of the stakeholders. So the future is quite bright, quite promising.
Yes.
And
yes,
we
I
are
agree with you.
yet to exhaust the opportunities that are at hand. So we'll keep trying, we'll keep pushing, and we'll keep the stakeholders on track. Thank you.
I mean, I see that, you're quite excited about artificial intelligence, and I feel like if I give you more time, you'll be able to say, a lot more things because that's your field. Thank you very much for sharing that with us. It's quite exciting, and the future is truly exciting. And I would recommend that to everyone following us on this webinar. I don't know if Help Desk can help me again to put the link for EHA Parcel. You can go to the website and read about it, and just engage us more, even beyond this webinar. Now, you'd spoken while you were answering the question that just vaccine wastage or vaccine monitoring is not the only thing that needs to be dealt with in this whole space. So I want to move a little bit to the social aspect of things, and this question is for Pharmacist Nafiu. So someone is asking, he says, vaccine hesitancy contributes to wastage, since unused vaccines may expire. And I would like that you answer this, as briefly as possible. So what programs are in place to improve acceptance at the household level? In Sokoto State, from your experience and your knowledge, what programs are in place to improve acceptance at household level?
Okay, even if you have potent vaccine, you have everything put in place, and there is blood rejection in the society, then it is going to be like a wastage at the facility level. So Sokoto State and the other implementing partners are doing their best to see that there is social mobilization in the community. There is awareness, massive awareness in the community that vaccines are there to protect individuals. And we all know from the history, vaccine almost 200 years ago has been in use. Like we know the history of vaccine. It started from the smallpox. Then now we have eradicated completely the smallpox in the world, and then we are trying to eradicate diseases like polio and measles, other diseases that are vaccine preventable diseases. And then if we have the mobilization, that is awareness in the community, we have more people that integrate into this awareness, like health professionals that talk to the people around them. I believe we will have much acceptance in the community.
All right, thank you, Pharmacist Nafiu. So I'm just going to, just before we bring this to an end, I just have two quick questions that I want to just throw. And I think I'll still give this to you, Pharmacist Nafiu. Someone is saying, good evening, good afternoon, sir. For vaccinators carrying antigens to rural areas, and I don't know, maybe Mr. Kazim might have an answer to this. It says sometimes we discover loose ice packs, and you know what that means. So what new strategies are in place to help manage that? So Pharmacist Nafiu, I don't know if it's something you've experienced before, you have, gotten reports of. Pharmacist Nafiu, can you hear me? Pharmacist Nafiu, are you there? Can you hear me?
Okay. Yeah. This is interesting question. This is interesting question. Yes. Yeah, I can hear you. I'm speaking. Can you hear me?
I can hear you. Yes, I can hear you.
Hello.
I can hear you. Yes, I can. I can hear you. Yes.
I think his internet is frozen.
Okay. Yeah. Yes. I think his internet is frozen. Okay. So I'll just jump to the last question, final one for Kazim. So someone is asking, how can healthcare work? Pharmacist Nafiu, I think your internet is okay.
Hello.
We can hear you now. Can you hear us? Okay. Help desk, can you help manage Pharmacist Nafiu's internet? All right. So thank you. So the next question for Kazim: how can healthcare workers track vaccine inventory and wastage without a real-time internet access? So I think it's an important one.
Yeah, really important one, and that is basically through the use of technology, data-driven solutions, digital, health solutions that are out there, including those designed and implemented by eHealth Africa and other partners out there. I think largely there are so many logistics management information solutions with offline capabilities that can collect data even where you have limited or very low connectivity. And after you get to maybe a better connection, you have a better connection, all of the data that you've collected can be synced and sent appropriately to wherever you have configured them to be sent to.
All right. Thank you very much. Pharmacist Nafiu, are you there?
Yes.
One more shot.
Sorry. Yeah, I lost my network. Can I continue?
Yes, just but briefly so that we can bring this to an
All
end.
right,
Yes.
all right. I made mention that for transportation of vaccine from the world level to, or from LGA to facility, you need to use ice pack, and that ice pack has to be conditioned. And what we call by ice pack condition, you have to have the ice pack that is not frozen, but halfway being frozen, but you have to condition it, and at the same time making sure that it is all just a 6 hours for the vaccination time, and then bring the vaccine to the cold chain equipment. But yeah, there is one interesting vaccine carrier that's been invented by the Gobi technology, and that vaccine carrier can hold the vaccine temperature for 7 days. And also you can use it in rural area for vaccination, and also it keeps the vaccine potent.
All right. Thank you very much. For everyone on the call, if you look at the webinar chat, we just uploaded or shared with you a one-pager giving you more details about the EHA parcel solution. It's a PDF document, so you can download it easily. Everyone, please go to the webinar chat box and you can download the PDF easily. For those following us on LinkedIn, I think we'll share the documents with you much later. And just before I bring up Andrew Karlyn to give us his closing remark, I find a comment here interesting, and I'll just read it just so that the panelists can take note of it and see. I mean, let's see what innovations can be used to also tackle that challenge. So someone says, good afternoon. Another way of vaccine wastage is intending pouring away of vaccines to meet up with vaccination targets. I've personally witnessed this with house-to-house polio vaccination. You mentioned the state. I don't want to mention the state. So I'm just, I think it's worthy of note to, just pay attention to and look into. So this brings us to the end of this interesting conversation. And with that, I'd like to bring up Andrew Karlyn to give us his closing remarks. Thank you, Andrew.
Thank you so much, and thank you to all the panelists and to the audience. This is really had a high level of participation and engagement from all of the audience. The Vox Pop was terrific, just to get the person on the street perspective, and that's what much of this work comes down to, is that there's the demand side, as we heard across the panelists, talking about issues of vaccine hesitancy and people's confidence and demand for the vaccine, allaying any concerns or fears they had. A big part of vaccine confidence, though, is the supply side that we've talked about today. And I think it's so important to recognize that the transparency and the ability to be able to track the systems as they improve and progress throughout throughout different campaigns and over time is a huge part of that. We heard quite a bit about concerns about, well, how shelf stable or what temperature stability of vaccines are. It's a very complex science, really, and we've put in processes and procedures and technologies to support that. The challenge is often there are many systems and they have to be integrated in a way which personally I think, and I think everyone on the panel will agree, is that the ability and the confidence of the cold chain manager, of the health worker, of the nurse, and everyone along the line needs to be supported so they can make good decisions about and make good planning about how vaccines are administered through the public health system and in the private health system as well. I learned quite a bit from the conversation. We're always learning and improving on it. We're really very happy about how these technologies, as well as the partnership with government, particularly as we saw with the pharmacist Nafiu from Sokoto State, that this is not something that any one entity can do alone. It's really largely for the government to lead and for the consumer, for the average citizen to participate in. We all need vaccines, and it's important to note vaccines are probably the most impactful, efficacious, have the highest return of any public health intervention that we can do, far beyond really anything else. So our commitment to continue this work is unwavering, despite all the changes and uncertainty in the sector. eHealth Africa and eHealth Africa Group is continuing to invest and continuing to drive because we know just how important this is. So I want to thank everybody for this really lively, great conversation. We've learned a lot. I hope you have as well. We're happy to continue to engage the conversation. Let me pass back to you, to just to follow up and provide all the socials and everything, and everybody needs to stay engaged. Thank you again, and appreciate it.
Thank you very much, Andrew, for that closing remark. We want to say a big thank you to all our panelists, first and foremost, for giving us your time and sharing your knowledge with us. Thank you for people who always, time and time again, tune in to Insight webinar. We really, really appreciate you. And we'd like to encourage you to download the document on EHA Parcel to learn more about it and share with people who you think will find it very useful. You can share the website link also to follow us on all our social media handles, on LinkedIn, on Twitter, on Instagram. We have a new community, eHealth Africa _community. Help desk can help me just put it in the chat box. eHealth Africa _community, where we'll be telling stories of the work that we're doing and the impact that we're making. If you follow us on social media, you'll see that we have our management team, currently in Kenya, discussing sustainable business models for primary health care in Africa. And so, I mean, it's exciting, the work that we do. So we ask you to please follow us, turn on post notifications to see what we're doing, and continue to engage with us. Thank you for being a part of this conversation. We appreciate you. Have a nice day.